Did you know that after the age of 50, the body doesn't suddenly become weak? It becomes underused, according to research published by Harvard Medical School. Adults can lose up to 1 to 2% of muscle mass every single year after midlife, especially if they stop challenging their muscles. For many older adults, this loss happens quietly. You don't feel it in one day. You feel it when standing up from a chair starts taking effort, when walking feels slower, when balance feels uncertain, and one unexpected fall suddenly changes everything. Doctors at the Mayo Clinic explain that the real danger after 50 is not age itself, but a condition called sarcopenia, the gradual loss of muscle strength due to inactivity. The good news is this: sarcopenia is not permanent. Studies from Johns Hopkins University show that muscle tissue remains responsive even in people in their 70 seconds and 80 seconds when given the right kind of stimulus. That means strength, balance, and confidence can be rebuilt at almost any age. Many seniors believe exercise has to be intense or painful to be effective, but research from the National Institute on Aging proves the opposite. Simple, controlled movements performed consistently are enough to stimulate muscle growth, improve coordination, and protect the joints. When combined with proper nutrition and a positive mindset, these small actions can dramatically slow aging from the inside out. Let's talk about one of the most powerful movements for independence, the act of standing up. Physical therapists at the Cleveland Clinic explain that the ability to rise from a seated position predicts long-term mobility and even life expectancy. When leg muscles weaken, everyday tasks like climbing stairs or getting out of a car become exhausting. That's why chair-based strength movements are so effective. They mimic real life, retrain the nervous system, and build usable strength, not just muscle size. Equally important is balance. According to the CDC, falls are the leading cause of injury among adults over 65 in the United States. But here's something most people don't realize. Balance isn't just about the feet. It's about the brain, muscles, and inner ear working together. Studies from Stanford University show that balance can be retrained through slow, deliberate movement that challenges coordination in a safe way. Nutrition plays an equally critical role. Researchers at Tufts University found that older adults who consume adequate protein throughout the day preserve significantly more muscle mass than those who don't. Even small changes, like adding protein to breakfast or include resistance movement after meals, improve muscle protein synthesis. Hydration also matters. Dehydration reduces muscle performance and increases fatigue, according to studies published in the Journal of Nutrition and Aging. Then there's mindset. Dr. Elia Crum of Stanford University has shown that how we think about aging directly affects physical outcomes. Older adults who believe their bodies can improve actually experience better strength gains than those who believe decline is inevitable. The brain influences hormone release, inflammation, and even how muscles respond to training. This means staying youthful isn't about denying age. It's about working with your biology instead of against it. Light daily movement, simple strength exercises, nourishing food, quality sleep, and a hopeful mindset together create a powerful anti-aging effect. Doctors from Harvard emphasize that consistency matters more than intensity. 5 to 10 minutes a day can outperform a single intense workout once a week. When movement becomes part of daily life, the body adapts without stress. Joints feel safer, muscles respond, confidence grows, and confidence changes everything. When seniors feel steady on their feet, they move more. When they move more, circulation improves, blood sugar stabilizes, energy increases. This positive cycle is well documented in research from the American College of Sports Medicine. Aging does not mean shrinking your life. It means choosing habits that protect your strength. The body is listening every day, and when you start giving it the signal to stay strong, it responds, no matter your age. One of the biggest myths about aging is that pain and weakness are unavoidable. Orthopedic specialists from Yale School of Medicine explain that most age-related discomfort comes from muscle imbalance and inactivity, not wear and tear. When certain muscles weaken, others are forced to overwork, leading to stiffness, poor posture, and instability. The solution isn't rest, it's gentle, targeted movement. Take the lower body. According to the University of Pittsburgh, strong legs reduce fall risk by more than 30% in older adults. But leg strength doesn't come from walking alone. Walking is excellent for circulation, but it does not sufficiently challenge the muscles responsible for standing, stabilizing, and reacting quickly. That's why controlled strengthening movements are essential. Calf muscles, for example, are often overlooked. Researchers from the University of Southern California found that calf strength directly affects balance recovery. When someone trips, the calves are among the first muscles to respond. Weak calves delay reaction time, increasing the chance of a fall. Simple heel lifting movements retrain this reflex and improve blood circulation, which also helps reduce swelling and fatigue. Hip strength is another critical factor. Physical therapy research from Northwestern University shows that weakness in the hip stabilizers leads to side-to-side sway during walking. This sway may seem minor, but it dramatically increases fall risk. Gentle side-leg movements activate these stabilizers and teach the body how to stay upright on uneven ground. Core strength also plays a role that many seniors underestimate. Doctors at the Cleveland Clinic describe the core as a natural back brace. When it's weak, the spine absorbs too much stress, leading to pain and poor posture. Floor-based movements that strengthen the hips and core without strain are among the safest options for older adults, especially those with joint concerns. Beyond exercise, lifestyle habits quietly shape how the body ages. Sleep, for example, is not optional. Research from the University of California, Berkeley shows that muscle repair and hormone regulation occur primarily during deep sleep. Poor sleep accelerates muscle loss and increases inflammation. Even improving sleep by 30 to 60 minutes per night can enhance physical recovery. Stress management is equally important. Chronic stress elevates cortisol, a hormone linked to muscle breakdown. Studies from Johns Hopkins reveal that simple breathing exercises and slow movement routines lower cortisol levels, improving muscle retention and balance control. Nutrition again ties everything together. Vitamin D and calcium are critical for bone strength according to the National Institutes of Health, but bones also need muscle tension to stay dense. That's why light resistance exercise combined with proper nutrition is far more effective than supplements alone. Positive expectation amplifies results. Dr. Andrew Huberman from Stanford explains that the nervous system adapts faster when the brain anticipates improvement. This means believing that movement is safe and beneficial reduces fear-based stiffness and improves coordination. Every time an older adult practices controlled movement, they send a signal to the brain that the body is capable. Over time, this rewires movement patterns. Balance improves. Steps feel lighter. Confidence replaces hesitation. You don't need perfection. You need repetition. Even missed days don't erase progress. What matters is returning to movement again and again. The body remembers that aging well is not about chasing youth. It's about preserving independence. Geriatric specialists from the University of Michigan explain that the strongest predictor of quality of life after 60 is not weight, not genetic, but functional mobility, the ability to move confidently through daily life. This is where consistency becomes powerful. Research published in the Journal of Geriatric Physical Therapy shows that older adults who perform simple strength and balance routines 3 to 5 times a week experience measurable improvements in as little as 4 weeks. Muscles become more responsive. Reaction time improves. Fear of falling decreases. Fear is often the invisible barrier. Once someone experiences instability, they begin to move less. Less movement leads to faster decline. Breaking this cycle requires safe, achievable actions that rebuild trust in the body. Slow, intentional exercises restore that trust step by step. Doctors from Mayo Clinic emphasize that aging muscles prefer slower movement. Fast, jerky motion increases injury risk, while slow control maximizes muscle activation. This is why gentle strength routines outperform aggressive workouts for seniors. Diet supports this transformation. According to research from Harvard T.H. Chan School of Public Health, evenly distributing protein intake across meals supports muscle maintenance far better than consuming it all at once. Adding colorful vegetables reduces inflammation, while healthy fats support joint lubrication and brain health. Hydration cannot be ignored. Even mild dehydration reduces balance and increases dizziness, especially in older adults. According to studies in the Journal of Gerontology, drinking water consistently throughout the day improves physical and mental performance. Mindset again closes the loop. Longevity research from Yale University shows that individuals with a positive perception of aging live longer and remain physically capable for more years. The body follows belief. Every repetition, every balanced step, every conscious breath is a vote for strength. Aging is not a downhill slope. It's a path shaped by daily choices. You don't need a gym. You don't need expensive equipment. You need awareness, patience, and the willingness to move with intention. When older adults commit to gentle strength, nourishing food, restorative sleep, and a hopeful mindset, the body responds with energy, stability, and resilience. Your future strength is built quietly, one day at a time. And the most important step is the one you take today.